Well, approximately 260,000 women are diagnosed with breast cancer each year. Many of those women turn to chemotherapy for treatment. Joining me now is Dr. Ruth Oratz with NYU Langone's Perlmutter Cancer Center, and Jennifer Mersdorf is a breast cancer survivor. Welcome to the show, ladies. I appreciate you joining me. Dr. Oratz, let's talk about this first. It's important for people to continue to hear this and talk about and learn about what is early stage breast cancer.
Well, most women will be diagnosed with early stage breast cancer. That's the kind of breast cancer that we detect if you go for your annual screening mammogram or see your doctor for a checkup and something small is felt in the breast. So early stage meaning it's limited to the breast or the localized lymph nodes.
And how has it generally been treated up until now?
Well, we've seen a lot of changes in the treatment of breast cancer. Until now, we felt that after surgery, most women would require chemotherapy in addition to perhaps hormonal therapy and other treatments. But now we have new information that really helps us with the use of the Oncotype test determine who are the women who will benefit the most from chemotherapy.
Well, that's exciting. Let's talk about the Oncotype test and the new information from the study you got.
We really know that breast cancer is more than just one disease. There are many, many different types of breast cancer. And we are trying to personalize our treatment to target the right therapy for each individual patient. And in order to do that, we want to identify the women with early stage breast cancer who are really going to get that benefit from chemotherapy and not give chemo to the patients who don't need it. And the Oncotype test helps us to determine that by analyzing the tumor and then giving us information about which tumor cells really are going to respond to chemotherapy treatment.
And Jennifer, let me bring you into the conversation here. I want to find out your story and kind of what went through your mind when you first got diagnosed and what your concerns were with the different treatments.
Yeah, I was diagnosed at age 36, 8 years ago, and I think what went through my mind is probably very similar to what goes through everyone's. Is trying to learn the language of cancer, trying to make decisions that are complicated and in a space you don't really understand. And I was very lucky to have a fantastic doctor who helped me understand about this test. And actually, I took it 8 years ago.
Yeah, talk to me about that. What was your experience with the Oncotype test, and how did you think it helped you and your doctor treat this?
Yeah, I mean, it's not really a test that's invasive to take, so that part's very easy. It's off your own tumor, but really what it is, it's information to help you make decisions. You want to partner with your doctor and have the knowledge to be able to have conversations together. But really, what it did is helped us decide, my husband and I, that we were not doing chemotherapy, and that wasn't the treatment track for me.
And the most important question, where are you now with your breast cancer, and how are you feeling?
I feel great. It's been 8 years, and after that experience, decided to dedicate myself to the Young Survival Coalition. I'm their third CEO, and spend my time now every day ensuring that young women across the country know that young women can and do get breast cancer, and if you do, you are not alone. And make sure you have the information you need to make the right decisions.
And Dr. Oratz, this Oncotype test, talk to me about what this has done for you and your fellow doctors in your field.
Well, this test and other tests like it have really revolutionized the way that we treat all kinds of cancer, in particular breast cancer, because again, we're drilling down on the molecular characteristics of that tumor. We're defining the different subtypes of breast cancer so that we really can target and personalize treatment for each individual. And as Jennifer said, partnering with doctor and patient together, shared decision making is really the model that we're looking to. So this test really, really helps us make those decisions together.
And final thoughts, Jennifer, for our viewing audience and Doc, where people can go for more information.
Well, if you are a young woman that's been diagnosed with breast cancer or know a young woman that's been diagnosed, please come to youngsurvival.org, or you can just Google Young Women Breast Cancer to make sure that we connect you to other young women and give you the tools you need.
And for more information about treatment, A great website is mybreastcancertreatment.org.
And a special thanks to Genomic Health for bringing us that information.